Good morning, ladies of Life Song. My name is Nora Gannigan. I'm married to Ed Gannigan, one of the pastors here at Life Song Community Church, and we're the proud parents of Joshua and Zachary. I'm sorry that I can't be here live to speak with you this morning. Joshua has resumed training for cross country, and Saturdays are their long runs, which means he's running at least 10 miles. I thought it'd be safer to videotape my portion just in case we don't make it back in time. My assignment today is to share with you how I am keeping spiritually nourished during this COVID-19 season. I'm going to be honest here, I'm not handling this COVID-19 season well at all. If I had to give myself a first quarter grade, it would be a C-. I love routines and predictability, maximizing my time, checking things off of my to-do list, and all of these things have gotten taken away. This always felt like just when I got a handle on one situation and how to cope with it, another challenge got thrown in and the stress started all over again. So it took some time, but I was finally brought back to my verse for the year, which is Isaiah 26:3. You will keep in perfect peace all who trust in you, all whose thoughts are fixed on you. I chose this verse because it relates to my one word for the year, which is rest. If you're not familiar with the concept of my one word, it's an exercise where instead of coming up with a list of resolutions for the new year, only to break them within the first 1 or 2 months, you would just choose one word to be your focus for the year. So it is challenging to find just that one word. I know I'm the worst perfectionist, but it's been really good. I feel like God's been faithful through the years, and he's provided very relevant, and I would oftentimes say that it's very prophetic for the kind of year I was going to have. So here's a list of my words through the years, beginning with 2013, which is when we first started implementing this practice. So 2013, the word was release. 2014, intentional. 2015, messy. 2016, aletheia, which is Greek for sincere, without wax or cover-up, truthfulness. 2017 was present, as in being 100% there in the moment. 2018, disciple, both the verb and the noun. 2019, 2 words again, Emmanuel and mindset. So this year's one word was a bit different for me because normally I start praying about it in November before the new year comes in and probably get it within a month. But this year I probably didn't get my one word until the first week of January. And even then, I felt like I didn't have a definition of the word rest that I felt encompassed everything that I wanted it to. So finally, 6 months later, here's a definition that I really like. Rest is a choice to trust in the Lord's ability to do what we cannot do and to not give up believing that he will act. Resting in God will result in being re-energized, refreshed, and satisfied. I also like this definition as it helps me to know how to rest just by breaking up the definition. So first of all, it's a choice. It's an act of the will to surrender to God's authority in my life. And secondly, trust in the Lord means that I recognize him as God and I give him his rightful place in my life. Third aspect of this definition is that I don't give up. And finally, the measure of success. I am re-energized, refreshed, and satisfied. So I think this word has really played out in my life in reminding me that rest is not a one-time event where I rest for 5 minutes or 30 minutes or half a day or a whole day or week, if I'm not lucky. But it's more of an attitude, a moment-by-moment attitude, where I choose, first of all, to give up control, and I surrender to God's leadership, goodness, trusting that my Heavenly Father wants to bless me with every good thing and that He's going to provide it when the time is right. And it also showed me that rest is a cycle where the first step again is a choice to trust the Lord. And as a result of that, how the verse in Isaiah says that the result of that is peace. And as think about other verses in the Bible that reiterate this, I think another verse I can think of is Proverbs 3, 5, and 6 that says, trust in the Lord with all your heart, lean not on your own understanding, in all your ways acknowledge Him, and He will make your paths straight. So thank you again for this time. I hope that you're encouraged by being reminded of God, our loving shepherd, looking out for us, having our best interests in mind, being right there with us as we face life's struggles, and being reminded that there is hope because our Father watches over us and He's a good Father. Thank you.
Hello, my name is Dr. Tiffany Endo, and I am a family physician practicing in the Pomona Valley area for the past 20 years. I have the pleasure of taking care of people of all ages, from the newborn to the elderly, and also low-risk pregnant women. I have been happily married to my wonderful husband for almost 25 years, and we have 3 amazing teenage children. I would like to especially thank my college daughter for helping me with the slides for today's presentation. So let's start talking about physical well-being during this very difficult and challenging time for everyone. I hope to give you some helpful hints to achieve healthier habits. My goal is to help each person achieve a higher level of wellness by focusing on health promotion and disease prevention. This stems from my background as an osteopathic physician, and hopefully you will have the same goal. I would encourage you to develop self-care habits that incorporate the balance between the mind, body, and spirit, with spirit being on top. Let us start by having you do a self-evaluation. How much time a day do you spend doing the following activities? The first column is very crucial as a woman of faith, which is spending time with God. Second is sleeping, which includes nighttime and napping throughout the day. Third is eating, including breakfast, lunch, dinner, and snacks. Next is exercising, which is any prolonged physical activity. Next is working and caring for others. This can include work outside the home or work inside the home, caring for your children or family members. Next is my least favorite, cleaning and cooking. And last is leisure activities and screen time. This can be any activity that you enjoy doing, such as your hobbies, and screen time including time watching TV, on the computer or phone, texting, and social media. According to the U.S. Bureau of Labor Statistics, here is how much time the average American spends during the following activities in 2018. Time with God is a mere 8.4 minutes, sleeping 8.82 hours, eating 1.19 hours, exercising 17.4 minutes, working and caring for others 7.6 hours, cleaning and cooking 2.69 hours, leisure activities and screen time 5.27 hours. As you work on your physical health, I would like to suggest the following amount of time each day for you to strive towards. Spending at least 30 minutes with God each day in prayer, quiet time, reading scripture, and/or journaling. Perhaps consider joining a small Bible study group with other women. For sleeping, as an adult, try to get 8 hours of sleep per day. If you're not getting enough sleep, adjust your schedule so that you can aim towards 8 hours. If you are staying home more and finding that you are sleeping over 10 hours a day, perhaps consider shortening that time. Eating 1.5 hours, exercising 30 minutes or more. It would be really great if you could be exercising at least an hour a day, but I know that can be difficult to find time for some of you. Working and caring for others, 6 to 8 hours. If you are living alone and not working, try to shift those hours to caring for yourself and find ways to help and serve others. Cleaning and cooking, 2 to 3 hours. And if you're really efficient, then you can shift those hours towards other things. Leisure activities and screen time. I recommend limiting it to no more than 2 to 3 hours, especially your screen time. Here's a chart showing what is the recommended hours of sleep per day by age group. As you can see, in the beginning of life, a newborn baby should have as much as 14 to 17 hours. But as we get older, those hours lessen. It is important to note here that you should encourage your children to sleep the recommended amount of hours as shown by the age groups. As an adult, the average amount of sleep should be between 7 to 9 hours per day. Some of you, I understand that sleep may be difficult to achieve due to various medical conditions. I do recommend for you to speak to your physician if you are having trouble achieving the recommended amount of sleep hours. Here are some helpful hints to help you get a better night's sleep. Be consistent. Go to bed the same time and get up the same time, including the weekends. Make sure your bedroom is quiet, dark, relaxing, and at a comfortable temperature. Remove electronic devices such as TV, computer, and smartphone from the bedroom. Avoid large meals, caffeine, and alcohol before bedtime. Last of all, get some exercise. Being physically active during the day can help you to fall asleep more easily at night. The next two areas are crucial for your physical well-being. These include nutrition and fitness. By no means am I an expert on nutrition, nor am I the best at following these recommendations. However, I do want to share some simple guidelines that can help you to achieve a healthier way of eating. If all of us can keep to a low-fat, low-sodium, and low-carbohydrate sugar meal plan, then we would have far less the amount of obesity, high blood pressure, and diabetes in this country. In general, it is best to consume less animal fat, especially red meat, and more plant-based foods. I do not recommend crash diets or any fad diets, such as the keto diet. Avoid rapid weight loss. Replace your beverages with water throughout the day and try to stop eating late at night. It is best to stop eating at least 2 hours before bedtime. I know that this will take much effort and will require discipline and accountability. I've included a few different websites that you can go to help you with ideas for your meal plans. My Plate Plan, the Dash Diet, and diabetes.org. One of the apps that I have been encouraging my patients to use is called MyFitnessPal. I know that there are many different types of apps out there, so if you're already using one, great, continue to use it. If you have not tried any, then this is an easy one to start. It is simple and free. As with most weight management programs, it is recommended for you to track your calories, understand the breakdown of the foods that you're eating, and log your physical activities. This app allows you to do the basic functions and really helps you to stay accountable. And you do not have to pay for the premium version. The average woman needs to eat about 2,000 calories per day to maintain her weight. If you are currently at a healthy weight, then it will be fine for you to consume this amount of calories. If you are underweight, consider working towards this amount. I certainly don't want you to become fixated on calories alone, but by keeping track, then you will know how much you are consuming and how much you need to work to burn off those calories. If you are trying to lose weight, the recommended amount of calories is 1,500 per day. And this is to lose 1 pound per week. That is a total of 48 pounds in 1 year. It can be rather difficult to try to maintain this amount of calories per day. I started using this app back in September and plugged in my height and weight with a goal of losing 10 pounds in 6 months. And it calculated the recommended goal is to have 1,610 calories per day. For most of my life, I have not had to watch what I eat and usually consume easily over 2,000 calories per day. However, as I began to plug in my food consumption, it forced me to adjust my way of eating to include healthier choices. The nice thing about this app is that it allows you to choose your food, and it is up to you to make those healthier choices. I will take you quickly through what my average meal plan might be in a day. As you can see, I'm still consuming about 2,000 calories per day. However, because I am incorporating exercise, then it balances out to the recommended amount of calories. So for this particular day, breakfast was $3.95, lunch was $4.88, and dinner was $888. Overall, I would encourage you to shift your calories to breakfast and lunch rather than having the highest amount of calories at dinner time. The reason is most of the time we are burning up calories during the day much easier than during nighttime. Here, it also includes my snacks for the day, which is really sad because just 2 little squares of Ghirardelli chocolate is 140 calories, whereas the orange and apple is a much healthier choice and less calories. By incorporating exercise, I was able to burn off 402 calories. Obviously, I still need to work on more ways to burn off calories and choose healthier choices. This graph shows a basic breakdown of how much calories, fat, and protein we should have in a day. Here's what the goal is, and here's what I actually consume in this example for the day. The next area of focus is fitness. The CDC gives some great suggestions about physical activity depending on your age group. I have included the link here for you to look at. It is recommended for the average adult to spend at least 150 minutes a week of moderate intensity activity, such as brisk walking, and at least 2 days a week of activities that strengthen muscles. In addition, for those older than 65, you should incorporate activities to improve balance, which will help with fall prevention. There are some great videos of chair exercises that I highly recommend to my elderly patients. So, 150 minutes each week sounds like a lot of time, but it's really not. That can be broken down to 30 minutes a day, 5 days a week. Remember, some activity is better than none. The reason why most children are able to consume so many calories is because they are physically active throughout the day. It is rare that you will see children sitting still. Thus, they are constantly burning off calories throughout the day. Unfortunately, for children who are not physically active and consuming excessive amounts of calories, then the problem of obesity and other health issues develops at an early age, and it is more difficult to change nutrition and fitness habits as they grow up. I have included some examples of physical activities and how many calories you are able to burn off with these activities. I encourage you to find physical activities that you enjoy doing, which will make it much easier to do and keep doing for the rest of your life. As we are being forced to stay home more, my encouragement is for you to take this time to reset and develop healthy habits for the next 30 days that will stay with you for a lifetime. If you are already doing well in these areas of sleep, nutrition, and fitness, then encourage those around you to do the same and work on the areas that I mentioned earlier in the self-evaluation. But if you are like me and most people who are struggling with these 3 areas, know that it takes much discipline, self-control, and accountability to achieve these healthy habits. Change is possible. However, it does take effort, and you have to be intentional with your choices. Finally, this last slide is a recent post from Caleb, which has been very helpful for me to focus on how I should approach God despite my circumstances. In happy moments, praise God. In difficult moments, seek God. In quiet moments, worship God. In painful moments, trust God. And in every moment, thank God. Take care, everyone. Stay healthy, and please continue to follow the recommended guidelines from the CDC regarding the coronavirus pandemic. Blessings to you and your family.
So I'm Dana Sakota. I've been a hand therapist and I work at St. Jude's. I took a little picture of it on my screen, but I work at St. Jude in Brea in the hand center. And I've been a hand therapist probably for over 20 years. I like what I do. We see all kind of different people, young and old. And so these are just some of the hands pictures that I like. And I'm going to talk about maybe 4, maybe 5 of these topics here, arthritis, carpal tunnel, and so on. And I think numbers 1 through 4, I saw all of those yesterday at work. So I think these are the most common diagnoses that I see in the clinic. I'm going to go and just start with arthritis. We all have thumbs, and unfortunately, I think a lot of us will develop thumb arthritis. Typically, in a normal thumb anatomy, you have, can you see my cursor?
Yes.
Okay, you'll have space between all your joints, and the space is filled with cartilage. The cartilage is kind of like a cushion, so that when your bones rub against each other, it doesn't hurt because the cartilage doesn't have nerve endings. But with arthritis, as you can see over here, the cartilage wears out, and then the bones rub on each other, and that's what causes a lot of pain. The causes of arthritis at the thumb, I mean, we can get arthritis in all of our fingers, but a lot of women get arthritis in the base of the thumb. It could be hereditary, so we can thank our parents. And repetitive pinching or twisting or just overusing our thumbs. We can have a trauma, like if you fall accidentally and your thumb bends backwards, or if you dislocate it. And then just being a woman and being over 50 years old will do it to us. And so you can think, like the little ape here, because the apes have thumbs, do I overuse my thumbs? So if you can ask yourself these questions, do you pull weeds? You know, you're using your thumbs. Do you use the pruner? Do you use a computer? Because if you use a computer, you're using your thumbs a lot. Do you text on your phone a lot? That swiping action will do it to our thumbs. And then people who just love to cook or do a lot of cleaning, people who use scissors because it's that opening and closing of the opening and closing of the shears will cause repetition at the base of the thumb. Just holding large objects or hand tools and so on. So a lot of repetition will cause us to have painful thumbs. Treatment for thumb arthritis is you're really just going to protect it. As the joint progresses with arthritis and just the destruction of the cartilage, there's nothing really that we can do to make the cartilage come back. There's just nothing. And so what we teach in therapy is to protect your joint and just prevent it from getting, that far along in the process. So we teach joint protection techniques where you're going to minimize the wear and tear. So really just try not to use your thumbs too much if possible. You're going to respect your pain. If your thumbs hurt, stop. Use bigger joints to do the job. And so you'll see this picture of the lady carrying her purse with her little finger joints. You can transfer that over to your bigger elbow joint to carry bags or groceries. I know I carry like 10 bags of groceries at a time, or I try to. You're going to avoid the key position. So where's the camera? So pinching like this is really hard on the thumb down here. So instead, you're going to try to pinch with tip to tip. And that actually is a better position for the thumb joint. Okay, so you're going to avoid that key pinch, like when you're pulling weeds or pulling the packages open. You can use adaptive equipment or just different tools to get the job done faster or easier. And so right here, you have the spring-loaded scissors. Those will do half the job for you because you're going to close and they'll open up for you, right? So then you only have to do 50% of the work. Pruners as well if you're working in the garden. And then if you have a lot of pain, you can wear a brace at night. If it gets really bad, you might want to see a hand surgeon, and they'll possibly do an injection, and then the last stage would be surgery. So we don't want to go there. And these are braces that you can buy just like on Amazon.
Yeah,
and
on the computer you can.
it protects this bone from moving too much, and so it'll help the joint down here from not deteriorating. Okay. Glucosamine, I'm looking at the chat right now. Glucosamine chondroitin supplements, do they help slow down the progression? I've gone to several different doctors and courses, and none of them are total in favor of glucosamine to build up the cartilage. There's not a lot of research from the hand doctor's point of view. So that's just what I've learned. Okay, the next one, I'm going to just breeze through these really quickly. So if you have questions, you can ask me, or we can talk on the side too. Okay, so carpal tunnel is another diagnosis that I see a lot. The carpals are these little bones. There's 8 little bones in your wrist. They form the bottom of the tunnel, and on the top of the tunnel is this big fat ligament. Can you see that? And so you've got your bones on the bottom and the ligament on top. And that little hole that it creates, or that tunnel, that's what we call the carpal tunnel. Okay, so carpal tunnel is the bones on the bottom with this ligament on top, oops, that doesn't stretch. And inside that little tunnel holds 9 tendons and a nerve, your median nerve. The nerve, we have 3 main ones that come from the neck that go all the way down to the hand. The median nerve, or the carpal tunnel nerve, it's in charge of the thumb, the index finger, and the middle finger. And so people who have carpal tunnel syndrome might have numbness or tingling in the thumb, index finger, and the middle finger. Where am I? Causes of carpal tunnel. Some people are just born with small wrists, and so it's just anatomically, we're just born that way, and our tunnels are smaller, and so there's more pressure on the nerve. You can sprain it, you can injure your wrist, and that will cause more swelling in that little tunnel. Pregnancy, a lot of times we're just big and fat and swollen during pregnancy, and so there's just more swelling in that tunnel that presses on the nerve. Repetitive actions over a long period of time. And so if you're bending your wrist back and forth, doing a job, then that's going to close the tunnel down, and that's going to put pressure on the nerve. Using like vibratory type of tools, like a lot of construction workers will get it. And then prolonged bending of the wrist and strong gripping. And so you can see in some of the pictures where if you're on the computer a lot, like this one, and you're just resting on the carpal tunnel, that's going to put pressure on the nerve. A lot of people, if they have carpal tunnel, it's hard for them to do their yoga or their exercises because of the bent wrist right here and the pressure. Bike riders have this bent wrist, also causing pressure. And repetitive activities like knitting, and then just typing a lot. Typing a lot will do it too, because your wrists are in a sustained position for a long period of time. And moms, right? Look at that wrist position. It's bent for a long time. That'll put pressure on the nerve. So the treatment, we really educate people on just positioning your wrists, like keep them straight. So keeping your wrist straight. If it bothers you at night, you can wear a brace, something similar to this, where it crosses over the wrist, and that keeps the wrist straight so the pressure is off of the nerve. You're going to avoid repetition. Some of the exercises you can do are just basic finger exercises, and that's going to get the tendons to glide back and forth through that tunnel in case there's any scar tissue, or if there's any swelling that you just want to move around. If it gets really bad, you'll go to the doctor, and they usually start off with anti-inflammatories since it's a inflammation issue, and they may inject it with cortisone, And then the last result, of course, is surgery. In surgery, what they do is they just cut that ligament, and so it relieves the pressure off of the nerve. Any questions? Not yet. Okay. The next one, diagnosis that I see a lot, is called de Quervain's tenosynovitis. So this is also called mommy's thumb, or gamer's thumb, or texting thumb. So moms get this a lot. Usually we can spot, we don't even have to know the diagnosis, but if we see a mom coming in to the clinic with a stroller, we're like, she has de Quervain's. You know, teenagers are getting gamer's thumbs, and just from texting a lot, I had that. I had to stop texting during quarantine for a little while because my thumbs hurt. So what's happening is that you've got two tendons that run along the thumb over here. Actually, you have a lot of tendons, but these are the two tendons that are involved. And so what they will either get overstretched or overused. And when that happens, you will have pain in this area. So a lot of moms, I've seen a lot of, moms at Lifesong will come with this issue when they have their new babies. Just because there's so much caring and taking care of the kids. The causes, very common in women, ages 30 to 50 years old. Again, repetitive thumb extension. So where's the camera? Just opening your thumb a lot will just really exacerbate it, pinching or twisting. And so if we look at some of the pictures over here, the moms, you can see how there's a lot of stretching of the wrists. The car seats are really hard, picking the car seat up in and out of the car, or the seat belt, that button. And this could go for grandmas too that are taking care or watching their grandkids. I see a lot of grandmas that are developing this too. Just the sustained holding of the babies, you can see the wrists, how they're bent so much. Or if the moms are nursing, it's just that sustained gripping for a long period of time, and their wrists just get overworked and just overbent and just over here. Like if you can picture the hand going back and forth when you're burping a baby, or holding the baby's head up, that really hurts new moms. And again, repetitive hobbies like knitting, cutting. I just saw a lady this past week who made 500 masks, fabric masks for COVID. She made 500 of them. So she cut by hand 1,000 pieces of material, and now she can't even use her hand to like hold a pencil. So it's just that repetitive using the scissors that really did her in. Using a mouse with your right hand, because you're constantly going back and forth with your wrist. So treatment would be stop the pain. A lot of people think no pain, no gain. That doesn't work for this. If there's pain, you stop, because if you keep on causing pain, you're going to go on this pain cycle where there's pain, which causes swelling, and swelling causes pain, and pain more swelling, and the thing never goes away. So just respect your pain. You want to rest it. And so this is probably my favorite brace over here, the Mueller one. It's really lightweight. It's like $10 at Walmart. If you're in a lot of pain, then you'd probably need something a little bit bigger that supports the forearm more. And then you're also just going to avoid repetitive wrist motions, keeping your wrist and your thumb straight instead of over bending them or overextending them. So as a new mom, you're just keeping your wrist straight. If you're on the computer a lot, there's these mice called a vertical mouse, and it just relieves some of the stress that puts on your thumb while you're at the keyboard. Anti-inflammatory medications are common. Doctors usually don't like to give cortisone injections in these, and surgery is even more rare. They just don't like to touch it because a lot of times it causes more problems. So yeah, it's just something that you have to take care of. There's not a lot to do in terms of surgery for it. And so it's really up to us to make sure our thumbs are healthy. Okay. I think this is the last diagnosis that I see very common in the clinic. It's called trigger finger, or it can be in your thumb, so it's called trigger thumb. It's an inflammation of your tendon. And so right here in the picture, you can see your tendon. We have 2 tendons that go to each finger. And sometimes there's a little cyst. You can see the cyst right here that forms on the tendon. And here's a side view of the cyst that's forming on the tendon. And I usually explain this to my patients. If you have a belt and you're trying to put your belt through your pants, right? Usually you can just slide the belt in and then slide the belt out and it's fine. But if you tie a knot in your belt and you try to put it through your belt loop, it's going to be hard for it to go in, and then it pops, and then you take the belt off and it pops again. That's kind of what's happening to your finger when there's a little cyst on your tendon, these little ligaments, and it can't because it's so fat, and so it'll stick, and then when you straighten your finger, it sticks or it pops again. And so treatment is resting it. Don't try to exercise it. A lot of people will try to exercise it out, but that's just going to make the cyst bigger. And so we'll try to rest it. We'll put a little splint on there to make it or prevent it from triggering again. We'll do these little exercises right here where you're just holding the thumb and you're bending it, but you're not making it pop. Okay, you're moving it because we want circulation, but you don't want it to trigger. And you could do the same, whoops, where's the camera? Same with your finger, if it's happening in your fingers, and then to the tip. And you just do that about 10 times. Okay, you can massage that area that's tender, but really, just don't make it trigger. Don't make it pop, because it's gonna make it worse, and just rest it. Kimi, how are we on time?
You have like a minute.
1 minute?
Yeah.
Okay. Carpal tunnel, where it's the thumb, index finger, and middle finger that go numb. And I think Janice read, and this was one of your questions before as well with Hannah. So on the other side of the hand is controlled by a different nerve. So that other nerve is called the ulnar nerve, and it innervates or it brings sensation to the pinky and half of the ring finger. And so if you hit like your funny bone really hard at your elbow, that's your ulnar nerve. And then the ulnar nerve is irritated. It's going to cause numbness on the other side of your hand. And I think that's what the question was, right? Now, what's it called then when the other half of your hand goes numb? A lot of times it's called cubital tunnel syndrome. So I talked about carpal tunnel syndrome. This is cubital tunnel syndrome, when the pinky and the ring finger go numb. It's the nerve that when you hit your funny bone, it kind of like zings to your hand. And so positioning is real key for this. You're going to avoid full elbow flexion over here. And so, because when you fully bend your elbow, it puts traction on that nerve and it really irritates it. And so this happens a lot if you're holding your cell phone to your ear, if you're sleeping with your elbows bent, if you're right-handed and you're brushing your hair, brushing your teeth, all those kind of things. If you're, on your iPad, if you're holding a book, all those things will put pressure on the nerve. And then also if you're leaning on it, and I couldn't find a picture quick enough, but like if you're at the computer and you're leaning on your elbow, or if you're driving and you're leaning on your elbow, that's also going to irritate that nerve.
Okay, thank you. Hi, I'm Joanna Lim. I've been coming to Lifesong for about 2.5 years. I am a general surgeon at Kaiser, Ontario. So I thought I would just share what's going on with COVID-19 with my understanding as a medical professional from reading the news and reading some of the medical literature. My first run of this was over 20 minutes, so I'm going to go really fast and I will be happy to fill in the details afterwards. So just to review, COVID-19, coronavirus disease in 2019, it's a respiratory virus. So think of it just like a really bad version of the cold. Right now, with our knowledge of testing, there are 9.5 million cases worldwide, about 480,000 deaths worldwide. To bring it home, 2.4 million cases in the US and 120,000 deaths reported. And our worst week was in mid-April. We were up to about 15,000 deaths a week. Just to give some perspective, compared to one of our worst years of the flu that was counting deaths over a 30-week period, we only got up to about 61,000 versus COVID-19 in the last 15 weeks, we're already counting about 68,000 deaths. So it does appear to be much deadlier. One thing to know is that we don't have a true denominator of how many cases of COVID-19. This number is probably much higher than this. So it's not quite as deadly as this ratio would suggest, but it's still, this number versus this number, still pretty bad. How does it present? It presents just like the flu. The only really unique symptom seems to be this new loss of taste or smell. Interestingly, it can persist even after the symptoms are gone, and we don't know how long it will persist because some people still have it. But otherwise, it's just like the cold or the flu, and treatment is the same as the cold or flu. Rest, hydration, Tylenol if you've got a fever. But when you have to start worrying that it's not just the cold or the flu? Well, if you've got any of these emergency symptoms, which are signs that you're not getting enough oxygen, that is when you need to go to the emergency room. So if you're having trouble breathing, if you're having chest pain, which means your heart is working harder to circulate the oxygen in your body, and confusion or having trouble staying awake, your brain is not getting enough oxygen. And then, of course, blue lips or face, meaning not enough circulation. Who gets it? Well, anyone can get it, but people who are at higher risk are people who are older, people who live in nursing homes or long-term care facilities, and people who have medical problems that make it hard for them to fight the disease because their immune system is not as strong. This data that was observed in people who were hospitalized early with COVID-19, almost all of them had at least one other medical problem, and especially if they were older. So flattening the curve, the reason for flattening the curve was because people who get sick with COVID-19, they get sick for a long time, much longer than the cold or the flu. And so they require much more medical care and support than those other diseases. And that means that they end up using a lot of hospital resources. And in the beginning, hospitals were overwhelmed. And unfortunately, they're starting to get overwhelmed again. I was just reading in the news that Houston, which is a major medical center, 97% of their ICUs were filled 2 days ago. That is a scary number, especially knowing how many ICU beds they probably have in general, 97% full. So what's going to happen when those other 3% get filled? Then how are they going to take care of people? So by flattening the curve, that allowed the medical system to catch up. But it's still important to just note that this disease goes on for a long time. How does it get spread? It gets spread through the air. Easiest way it's spread, someone breathes it out, another person breathes it in. The other way that it gets spread is someone breathes it out, it lands on something, becomes what we call a fomite, and then it gets picked up again. So how long can things stay on a surface and be contagious? Describe something, these numbers, which I'm sure we've all seen, but really the important thing is that doesn't happen without it going from your hand to your eyes, nose, mouth. So wash your hands, pretty simple. How far can we send something when we breathe? It's pretty far. However, the good news, if you would like to think of it, is that COVID-19 is kind of a bulky virus. It's about twice the size of the average influenza virus, so it can't spread as far. The 6 foot, that's just a rule of thumb that was made based on just what we know of like physics and other particles that spread through the air. It's not specific to COVID-19, but better to be safe than sorry. So I'm sure we've all seen this in social media. It's nice, it makes us feel good about wearing masks. I tried to find the original article data for these numbers, couldn't find it. But realistically, just going back again to what we know of how airborne spread, wearing a mask is helpful, spreading out is helpful. Testing, this is the one thing that's really been in the news a lot. And so the way that they find, we have been able to pretty reliably test for the coronavirus. But one of the things that we ask ourselves in medicine is, if I order this test, how will it change anything? And of course, you know, the value in a test is usually if there's an accompanying treatment. And to be repetitive, we don't have a treatment for this disease. So if we don't have a treatment, then what's the value of the test? So right now, a lot of it is sort of academic because it helps us do contact tracing. It helps us to understand how this disease behaves, and it's giving us a lot of data. And it does also help that if someone is really severe and symptomatic, it helps us to isolate them and protect other people in the hospital. So who needs to be screened or tested? You basically have to ask yourself, initially you should, if you have symptoms and or if you've been in contact with someone with COVID-19, treat your symptoms like you've got a cold. Rest, hydrate, take your temperature, take Tylenol if you've got a fever. Be aware, be careful, but at the same time, if this is a mild version of COVID-19, it's going to play out just like a cold or the flu, and there's not really any need to, one, go to the hospital and expose yourself in getting tested, or two, expose others if you do have a very mild version of COVID-19. However, if you are starting to worsen, or if you have, if you're having any of those emergency symptoms that I talked about earlier, then yes, go get tested. And thankfully, testing has really increased, so we are not really in any shortage of tests. But you have to know, some of the tests take up to 6 days to come back. You might already be almost done with your disease course by then. So you just have to think about that when you're getting tested. The other new big thing in the news is antibody testing. So if someone has been exposed to a virus, they form antibodies to treat that. And so antibodies are a way of saying that the virus has been there. So it does show past exposure, but it does not mean that you're immune. It doesn't mean that you would never get, it doesn't mean that you can't get the virus again. And it doesn't mean that you couldn't get sick from it again. We just don't know that yet. It's possible that we might find that out in the future, but right now we don't know. It also does not mean that you're not contagious. If you have the antibody, you could still have viral load. You could still be shedding the virus. And then it does advance our medical knowledge, just like the antigen testing. A lot of it is just, it helps us to understand the disease better and will hopefully be used for practical application. But right now, a lot of it is just to help us understand. So where does the vaccine happen? So the vaccine is, we give people parts of the virus and or something similar to the virus, and then we hope that that will induce antibody induction. Right now, there are a whole bunch of studies being done. And so I have to tell you that knowing the language, phase 1, phase 2, that doesn't really mean that much. It means that it didn't make people sick, and it means that it did help them to form antibodies. But again, we don't really know the significance of the antibodies. We don't know if it prevents disease. So that's where phase 3 comes in. Phase 3 is the real time where the rubber meets the road for vaccines. That's when, you know, you expose someone, they get antibodies, you expose them again, and they don't get sick. So that is where everything is really important, and that is realistically going to take a while to test. And so that's why, you know, these optimistic numbers of a vaccine in a year, that would be great, but honestly, that would be practically hard to make it happen. I have to just pitch in for 5 seconds. If you're going to think about getting COVID-19, if you want a COVID-19 vaccine, then you got to think about getting a flu vaccine. And right now, people are still getting the flu and people are still dying from the flu. So it's not like the flu decided to take a timeout while take it easy on us while COVID-19 is going on. No. One, we see people who are infected with COVID-19 and influenza in the hospital. And the other thing is that, again, people are still getting sick from influenza. So if you haven't gotten your flu vaccine, there's actually some value in still getting the flu vaccine now. And actually, one of the first things that we do if people come in with COVID-19 in the hospital is we give them the flu vaccine, because we don't want them to get infected with more than one thing. And there was a question of, would I take the vaccine? Yeah. If the vaccine 100% gave me mild symptoms, made me feel like I had the flu for a few days, but it gave me antibodies so that I wouldn't have to worry about dying from COVID-19 later, it'd be worth it. It would be worth it if it were only 60% effective, where just like the flu, I took it, it made me sick for a few days, but I could know that I was 60% less likely to get COVID-19, which could be life-threatening. Yeah, I would take it. So where are we now? We're rising. We're not in good shape. We did flatten the curve a little bit in the middle, but you can see it never really fell anywhere. It was always increasing. And then again, these numbers county by county, you can see, we had a few days of blue here and there, but for the most part, we never really decreased in our accumulation of COVID-19 infections. So it's still rising. You can see in the 4 counties we live in, it's rising. So where are we now? We flattened the curve, but now cases are rising again. And we can recognize the disease, but we still don't have a treatment. So right now, all that we're left with is prevention. An ounce of prevention is worth a pound of cure. So I feel like this is not that encouraging of a talk, but I think it's important for us to know where we stand, and I'm happy to answer any questions.
Just wanted to take like 2 seconds to talk about was mask wearing. So, okay, so the whole purpose of the mask is you want to cover your nose and you want to cover your mouth, because in the back of your head, your nose and your mouth are one open cavity. Okay, so it is all the same. If you only covering your mouth, you're only covering your mouth and you're not covering your nose, you're getting pretty much zero benefit from wearing your mask. So that's one thing. And so the purpose of the mask is to protect others. The mask covering your nose and your mouth, that's helpful. In terms of protecting yourself, the bad news is that a lot of these masks, they don't do that much. And the real benefit is when you breathe and the air goes in through this filtered stuff and not around the mask. So in order to get the benefit of all these filters and all these special masks, the N95 mask, all your air has to go in and out of the mask and not around it. So it kind of drives me, in the beginning, it kind of would drive me crazy. I would go to the grocery store and see people with these N95 masks that are like this, hanging under their nose, or they're like halfway on their face. When we use them in the hospital, we actually have to get fitted every single year and tested for the fit of the N95, because it actually hurts when you wear it for a long period of time, because there's a lot of pressure to make sure that there's no air leaking around the mask and it's all going in and out of the mask. So all that to say, wearing a mask is a great idea, and the vast benefit is protecting other people. And then to protect yourself, what's really more beneficial is just to stay 6 feet away from people. So it's the combination of those things that is really useful.
Okay, there's a question for you about your thoughts on the hydrochloroquine.
Oh, okay. So the hydroxychloroquine. So the reason that, testing.
Yeah, there's
Okay.
another one. There's
So
two.
Okay, let's see. So the hydroxychloroquine, the rationale behind that is they are doing this thing. A lot of pharmaceutical companies are doing this thing where they basically they take drugs that people are already using and then trying to see if there's any benefit. It is sort of, it's this idea of like taking a bowl of like wet spaghetti, throwing it on the wall and just seeing what sticks. It's very kind of unscientific in terms of how we normally test drugs, how we test medications, surgeries, procedures. That's kind of what's being done. And so that's kind of where hydroxychloroquine came up with an idea, because there was a protein that seems to be, so I have to say, so the big study that showed that it was useful has been retracted. And that's, it's hard to take an idea back once it's been put out there, and it's been actually retracted, and the database it was based on is highly questionable. And so it's probably not that beneficial. We don't know if it's beneficial. I guess I'll just say that. One thing though is that it is actually a medication that causes heart arrhythmias. And so it's not something that you would want to take lightly. And especially since we don't know if it really works. So it's not as harmless a drug as you would suspect. And then the other sad thing is that because so many people are using hydroxychloroquine, the people who use it for its intended course, so a lot of people who have like arthritis or lupus, they're having a hard time getting the medication that they use on a regular basis. So it's probably not ready for general public use. Probably should only be used in like very studied settings. In terms of testing, let me see, I have a slide on that. Let me see if I can share how do I share my screen?
There should be a bottom, like on the bottom, a green says share screen.
Okay, I think I'm doing it. Is it working?
No.
Oh. Okay. Wait. Oh, okay. It would like to allow me to share the screen. Oh wait, it says I have to quit Zoom and then, okay. I'll just look at my screen. Sorry, I can't show my slides, I think, because I didn't set it up beforehand, sorry.
Oh.
Okay, so I thought that one thing, where did it go? Where did you all go? Okay, there you are, you're back. Okay, sorry, let me just pull up my slides on my other computer so I can look at them while I look at you. So one thing that's really interesting about testing when you're not symptomatic is, okay, let me back up. So there was all this hubbub about, one of the WHO officials said that it's very rare for asymptomatic people to spread the virus, okay? And that was unfortunately, because she's a very academic person, she was using the term in a way that we don't use the term. So, there's, darn, okay, maybe, oh wait, okay, I'm gonna share. Can you see?
That works. Yeah, that works. Yeah.
Is it backwards?
It says asymptomatic and then pre-symptomatic and symptomatic.
Okay, great. Okay, we'll just kind of be a little jerry rig this. Okay, so what we do know is that when people get the virus, there is about a 2 to 15 day period for most people before they get symptoms, okay? So these people are pre-symptomatic. They don't have any symptoms, but they're going to get it. And then they're symptomatic. There is a very small subset of people who never get symptoms when they have COVID. It's really weird, but we know it exists, okay? And actually, and we suspect there are actually a lot of people who are asymptomatic, right? The CDC yesterday, they gave a statement that they think that 35% of people who get COVID never know that they have it, either because they are truly never symptomatic, or even when they get symptoms, they're very, very mild and people just don't think anything of it, okay? And so the problem is that, but we know that in this pre-symptomatic phase, people are very contagious. Some virologists are actually suspicious that people are most contagious in the 48 to 72 hours before people become symptomatic. So that is kind of that's why all these public health measures are really important, because people are contagious when they're not symptomatic yet. And so one thing that's interesting is that in testing is that, so if I was exposed to coronavirus and I'm going to get sick and I get tested on the day that I get exposed, I am almost 100% likely to get a false negative test on a COVID, because the COVID test tests how much virus you have in your body. And it takes time for me, who has received the virus is a parasite and it replicates itself inside my own cells, okay? And so it's got to take time to get that machine started. And so if you get tested the day that you're exposed, it's going to be a false negative. You're going to think you're not sick. And some people will take that information and just walk around and think they're not contagious when they actually are. And then we know that if you get tested about 4 days after you are exposed, you are still about like a 40% likelihood of getting a false negative test, because it just takes time. And so the most sensitive time for the test is actually after someone is symptomatic. Then the test is the most accurate. But the problem is that you were already contagious. And so that's kind of the tough thing about this testing, is it doesn't actually change what is going to happen, and it often won't change what should be done, like how a person should behave as a sick person, how the disease should be managed. It's kind of a little after the fact. And so that's why, unfortunately, the testing isn't as practically valuable right now as we would hope.